Dr. Gary Leach at Tower Urology. We're adjacent to Cedars-Sinai Medical Center in West Los Angeles. I'm a urologist that specializes in bladder control problems and sexual function issues. So I've been at Tower Urology for 25 years, and before that I was the chief of urology at Kaiser in Los Angeles. Almost all treatments related to prostate cancer have potential side effects, whether it's radiation, surgery, or other treatments. And frequently the side effects have a huge negative effect on quality of life. So what we do is see the patients that have these complications or side effects, evaluate them to find out what the specific cause is, and that gives us some idea of what treatment we can give them to help eliminate their side effect, whether it's a bladder control issue, sexual function issue, or whatever it is. And I would say almost always there's something that can be done to dramatically improve their quality of life. Yeah, very commonly. As mentioned during my talk, I saw him the other day has been wearing pads for almost 10 years following his surgery. And I said, why didn't you come sooner? He said, I didn't know anything could be done. And so to have somebody like that that's been wearing 8 or 10 diapers a day and allow them to have a kind of a treatment that improves their leakage by 95% is a dramatic improvement of their quality of life. Well, there's constant improvements, I think, with regard to bladder control issues. As I mentioned during my talk, we have a lot of experience with a device called a bladder pacemaker device called InterStim for people where medications don't work and other types of therapy hasn't worked, and that's about 70 or 80% effective. We also use a lot of Botox now for bladder problems, which is relatively new over the last few years. And actually, it's even paid for by insurance companies and Medicare now because, again, it's about 50% effective. And for a lot of people that are having major urgency and frequency problems, it can really help improve their bladder control. So there are constant developments. And I think that's one of the things that I would tell people. If you saw a doctor 5 years ago and they said, no, well, there's nothing we can do, or whatever they tried didn't work, don't be discouraged. Come back, because there's always new things that might be more effective. Well, I think there's a lot of information on the internet. There are also organizations, one group that does a lot of really worthwhile work is called National Association for Continence. It's a nonprofit group that directs people as far as giving them more information about bladder control problems and what could be done. A lot of the companies that make the penile implant and other things have a tremendous amount of education material online regarding erectile dysfunction as well. So there's a lot of information out there. I think it's just incumbent upon the person to take some initiative and try to find out about it. And obviously they can, always call for their physician for direction as well. I would just emphasize that if somebody's having a major quality of life issue because of a side effect of treatment, whether it's sexual function, incontinence, or other quality of life issue, that they should not accept it and they should really be aggressive about finding an expert to take care of it, because almost always something can be done to make it better.